And so I'm super pleased for our inaugural monthly roundtable to have Sharon Bakers, who is the director of the Division of Tobacco Prevention and Control at DHEC. And I thought it would be really helpful to everyone as at the start of the year, the start of the series, to hear from Sharon from the state office perspective about what's going on with tobacco control and prevention, what's going on with smoking in our state, and what the priorities are at DHEC. And so that will all trickle down to all of us working at our different levels. So with that, I'm going to stop sharing my screen, and Sharon is going to brilliantly share her screen, and I'll turn it over to Sharon.
Thank you so much, Rebecca. Can you hear me okay?
Yes.
All right, let's see if I can do this correctly. Let's see if I can do this correctly. Hold on 1 second. Yes. It worked before. Let's see. I know I can do it.
Remember, it was I forgot which screen you said it was the correct one. There you go.
2. That's not the right one. Hang on 1 second. Okay, hold on. I promise I can do it. I promise I can do it. Let's see. Okay, now I've got to get back to. All right, just a second. Hit that first, and then I have to do. All right, that'll be number 2.
Before y'all all came on, Sharon and I were both getting our PowerPoints up on the screen. And for some reason, I have always had a brain block about getting my PowerPoint up there and advancing the screens. And so I feel you, Sharon.
All right, how is it looking? Can you see it?
Nope.
Okay, just a second. I'm gonna get this done, y'all. I'm gonna get it, I promise. All right,
we see your background now. We don't see the PowerPoint. There it is.
All right, we got it? We got it? All right, all right.
Oh.
If it was in advance, let me know, but I think we got it this time. Okay, I got 3 screens and it just confuses me. So I think I get it and then I mess it up. So if everybody can hear me and see, right? All right, let's roll, let's roll. All right, thank you all for joining me today for the first South Carolina Tobacco Roundtable. As Rebecca mentioned, I'm Sharon Bakers. I'm the director of DHEC's Division of Tobacco Prevention and Control. Our team is South Carolina's representative to the National Tobacco Control Program funded by CDC's Office on Smoking and Health. Our division is comprised of 9 program staff with a combined over 100 years experience in tobacco control, with each member focusing on their own specialty area as part of a comprehensive tobacco control program. The goals of our program over the next 5 years are to prevent initiation of tobacco use among youth, to promote quitting among adults and youth, to eliminate exposure to secondhand smoke and aerosol, and to advance health equity by identifying and eliminating commercial tobacco product-related inequities and disparities. And you'll notice that these goals, as well as our program work plans, support and align with those outlined in the State Tobacco Plan for 2021 to 2026, eliminating the toll of tobacco products in South Carolina that Rebecca was just talking about. All right, so I believe over the next few years, one of the most important things that we can do in tobacco control is to reframe our issue. Because we have had some success as a state, many think that we've solved the tobacco problem. However, as we're all aware, commercial tobacco use continues to kill over 480,000 users every year. And that's about 7,200 in South Carolina alone, according to our partners at the Campaign for Tobacco-Free Kids. This is primarily from smoking-related chronic disease, including the leading causes of death in South Carolina: heart disease, cancer, chronic lower respiratory diseases like COPD and emphysema, and stroke. It also continues to be very costly, with $1.9 billion in annual healthcare costs directly caused by smoking. So where are we in terms of our state smoking rates? While we've celebrated a steady decline in our rates of youth smoking, we've not been successful in moving the needle on adult prevalence. As you can see in the graph, adult cigarette smoking has remained fairly steady despite our efforts and remains above the national average and significantly above the Healthy People 2030 target rate. Now, I'm excited to let everybody know that we will have updated youth and adult tobacco survey data in the coming months. Both surveys have been in the field and are finalizing data collection and or analysis. And the division will be partnering with Smoke Free SC to present the findings of the surveys through webinars and make the data available to partners in the state. The division now has a dedicated section of the agency's website where all of our reports are housed, and you'll see the web address to that site at the bottom of this slide. So Rebecca, I'm thinking that we'll probably make these slides available so that folks will be able to access that link. All right. So in fact, the stagnancy of our adult tobacco prevalence rate has landed South Carolina among states with the dubious honor of being part of Tobacco Nation. It's defined by state trends in adult smoking over time that have consistently ranked among the top 25% in the US across several years. In addition to higher adult smoking rates, states including in Tobacco Nation also share a number of other characteristics, such as being less well-off financially, having poorer overall health outcomes, more limited access to care, and lack of smoke-free laws and other tobacco control policies designed to protect the public and encourage cessation. Removing our state from Tobacco Nation is going to take a concentrated and consistent effort by us all. For our part, the 5-year work plans developed by our tobacco division team take a new approach than in years past. While we're still continuing to serve the entire state with programs and services, our emphasis is on accelerating reductions in tobacco use among populations and those in geographic regions of the state that have the highest rates of adult smoking, outlined here on the slide. By igniting reductions in these high prevalence areas, we should then begin to see a corresponding reduction in our state's overall smoking prevalence, leading to fewer chronic diseases and lives saved. We intend to accomplish this through a focus on eliminating disparities, promoting health equity, and addressing social determinants of health through policies, systems, and environmental changes. To start, we've expanded our already robust suite of culturally and linguistically appropriate quitting services. Though there are many effective evidence-based tobacco treatment programs and resources available, our contribution to cessation centers around the South Carolina Tobacco Quit Line. Having served over 250,000 participants since 2006, the Quit Line continues to evolve to meet the needs of our state. I invite you to visit the newly launched Quit Line website at quitnowsc.org to learn all about the Quit Line, from the various methods of enrollment to support provided, to the newest offerings such as our American Indian Commercial Tobacco Cessation Program and the Live Vape Free Youth Cessation Support Program. This is in addition to our other successful services, such as the Behavioral Health Program, C10 program for pregnant tobacco users, and referral to the Baby and Me Tobacco Free program offered through our division at DHEC, and the Déjelo Ya Spanish service. Quit Now SC is your one-stop stop of all things Quit Line, and I encourage you to take a look. To reduce chronic diseases and death, healthcare providers must address tobacco use among their patients, and we offer protocols and technologies to make referrals to quitting services easy and straightforward. The division's efforts will continue to focus on our healthcare settings, reaching our priority populations, including FQHCs, mental health and substance use disorder treatment facilities, Medicaid providers, and cancer centers. While we continue to support quitting in these high priority areas, it's also imperative that we re-educate community leaders who aren't even aware that their residents remain unprotected from exposure to secondhand smoke and vaping aerosol in public places. In fact, only about 42% of our state's residents are covered by some level of protection, and even fewer of these are comprehensive protections. Whether looking at the DHEC Tobacco Division's Adult Tobacco Survey results or county health rankings, the top 5 may be in a different order, but they are all in the same places. Our team is doubling down on these geographic areas, such as Dillon, Marlboro, Chesterfield, Allendale, and Jasper counties, to support community coalition efforts designed to implement these effective tobacco control measures shown to reduce use. DHEC health directors are joining in to educate these leaders and provide smoke-free Palmetto State certification awards to those with comprehensive policies protecting their residents from these harms. We know what works: promoting quitting through services such as the Quit Line, providing protections from exposure to secondhand smoke and vaping aerosol, managing point of sale prompts where advertising and ease of access are concentrated, and providing appropriate messaging and education are all keys to helping South Carolina exit tobacco nation. As illustrated in the tobacco control vaccine, we all know what works. We must work together to make it happen. Finally, we are continuing to broaden our efforts to prevent the use of electronic nicotine delivery systems, such as e-cigarettes or other emerging tobacco products among our young people. As you can see in the graph, and as mentioned earlier, we've celebrated historic declines in our youth cigarette smoking rates, but during the same time period, use of electronic cigarettes has skyrocketed. To address this issue, peer group-based digital and social media campaigns are being implemented to raise awareness about product addictiveness and potential health hazards, such as impact on brain development. Evaluation findings have been very positive and show that our campaigns have high awareness, relevance, appeal, and effectiveness among South Carolina youth. Additionally, South Carolina is the first state in the nation to offer the Quit the Hit program to provide quitting support to the multitude of young people who started using these products for fun, thinking they were harmless water vapor, only to now find themselves heavily addicted to nicotine products, which have been manipulated with flavors and biochemically, leading to the introduction of nicotine salts, which offer a smoother, less harsh experience for the new tobacco user. We ask you to join us to reestablish the urgency to address tobacco use within our state. There are many ways to become engaged in tobacco control efforts, from building or joining a local coalition, to promoting information about the South Carolina Quit Line, to volunteering to collect point of sale data through local store assessments. You can contact Rebecca following today's roundtable to explore ways to get involved, or feel free to contact me for more information, and my contact information is listed here. Together, we can remove South Carolina from Tobacco Nation. Thank you. And Rebecca.
Terrific, Sharon. Thank you. So this is the point where we're going to have to experiment with how you have a roundtable virtually. And so I would ask folks to go, Sharon, you've got a hand clapping, just so in case you don't see all of the reactions there. So I would ask you all to do a combination of raising your hand or throw a question in the chat box. What do you want to know? Is there anything you'd like Sharon to clarify? Is there anything you'd like to add? What would you like to talk about what's going on in South Carolina? And we're just going to have to do a little trial and error to see how this goes with 29 people. I know you all have questions. There's nothing that's not okay. Okay. So Kenny Ray would like us to know that the Center for Black Health and Equity is building capacity in Charleston to address sale restriction pertaining to menthol and flavor. Kenny, would you like to unmute and say a little bit about that?
Good morning to everyone. I am Kenny Ray. I'm the Director of Programs at the Center for Black Health and Equity. So we're working with the National Council of Negro Women in Charleston, and they have been meticulously building their capacity around this work. They've never done this work before, but they're interested in working in public health and around this work. And they are building an education campaign. They're building a multicultural ethnic coalition. They are developing their community mobilization plan, their education campaign plan. All of that is building up to a level where after February of this year, they will be implementing those plans. They have a roadmap that should be finalized by the end of next week. And that roadmap, once they're completed with it, they're able to share how they're proposing to move forward as a coalition. Last year, they were in the throes of working with the tri-health agencies and fighting against preemption. They made some calls and some references to the Black Caucus around that issue. We understand that their contributions were helpful in staving off preemption in the last legislative session, but we anticipate those challenges happening again this legislative session. So the fight and the struggle continues. So hopefully this coalition can join that coalition, and because it's all hands on deck in order to realize a lot of what Sharon has just presented.
Thank you, Kenny. I know there's several of us on here that are participating in that group. If there are people on here that weren't aware that want to get involved, how would you suggest they do that?
Yes, LaShondra Morgan, Dr. LaShondra Morgan is the point person for the National Council of Negro Women in Charleston. There's a separate coalition that they are the organization of. And so by connecting with her, you will be able to be aware of the upcoming planning meetings. They are divided into some subcommittees. So there's subcommittee work that is constantly happening. So there's going to need to be some support around the policy subcommittee. The Public Health Law Center has provided them with the model draft language for the Charleston area. But then the Public Health Law Center also has contributed documents and information around what to share with the elected officials at the state legislature around preemption. So their next planning meeting is going to entail a lot of that information and how they want to proceed with the leadership of the tri-health agencies.
So yeah, that group is actually called Breathe Easy Tri-County. And what I'm thinking as you're talking is this might be a wonderful way to use the new email group that we are going to be launching, the sort of statewide South Carolina Tobacco Partners. We can try to make sure that people make different announcements through that to reach folks about things that are going on. Thank you, Kenny. Let's see. Okay, so Beth Johnson put in the chat box LaShondra Morgan's email address, and that would be a contact. And then Dr. Keeley had a question for Sharon. I don't know if you're nodding. Did you see it? Do you need me to? It's could you speak to hold out the Lifeline program efforts on tobacco use and prevention and cessation support? Go ahead to you, Sharon.
Right. Absolutely. So Hold Out the Lifeline has been a longtime partner with the Division of Tobacco Prevention and Control here at DHEC and has worked over many years to help create a network to provide information to faith communities and faith organizations about tobacco use, about tobacco-related issues, and also about cancer-related issues as it pertains to tobacco use. So we have actually stepped up our relationship with Hold Out the Lifeline to include them in some additional efforts. They are our lead agency contractor for our community-based tobacco disparities program, which is one of the required elements of our CDC cooperative agreement. And it is designed to, and for South Carolina specifically, to address tobacco use in particular geographic regions to try to reduce rates and to bring in some protections to for secondhand smoke in areas that they don't already exist. And so Riata Scott is our team's representative who is leading that effort. And I saw Riata's name on the list here. So I want to definitely make sure everyone knows that Riata is leading that effort for our team and is partnering directly with Hold Out the Lifeline to support the community-based tobacco disparities initiative in Dillon County and the PD area, as well as Allendale County. So I mentioned those on the slides pertaining to our geographic regions. Those two areas have shown in numerous data reports to be our two current highest rates of adult smoking prevalence, and it's over 30%. So it's those two communities on their own just are really keeping our adult smoking prevalence rates stagnant. So we are hoping to work directly with Hold Out the Lifeline on the community-based tobacco disparities effort, and they are working to build a coalition in both Dillon County and Allendale County and the surrounding areas to develop plans based on identified needs to address tobacco use related to those needs in these communities. So they both have high prevalence rates. They both have very few smoke-free protections. They have low rates of utilization of our South Carolina tobacco quit line. And we are also looking and working with Barbara from the point of sale standpoint. So doing store assessments to take a look and see what that looks like from a community standpoint. So the coalitions are busy preparing annual action plans, and we are excited to be able to take a look at those sometime next week, hopefully, to see what they plan for the next year to begin implementation of some tobacco-focused efforts to improve those different rates. And I will mention one other thing for Hold Out the Lifeline. They are also a contractor with us to educate the Low Country and Midlands areas in particular about issues related to secondhand smoke. So they are working in Jasper and Allendale counties to develop some secondhand smoke educational campaigns and connect with community organizations and community groups to provide education about resources that are available to help bring about secondhand smoke protections, as well as provide information on cessation that can be available for community members.
Okay. There are two tobacco treatment specialists from MUSC. I'm sorry to put y'all on the spot, but I noticed y'all introduced yourselves in the chat box. I'm wondering if y'all might tell us a little bit about what's happening down there at the one-on-one or program level related to, you know, cessation programs y'all are doing. And I got to scroll all the way up in my chat box to remember exactly who it was. So this is Bridget and Demetris. Maybe one of you would want to tell us a little bit about this.
Good morning. So we are through our South Carolina Tobacco Treatment Program through MUSC that originated out of Charleston. So that was the main location. And then here recently, over the last year, they branched out to the other sister hospitals, which is Florence and Marion, which that's where Demetrius is. And then myself, I'm here in Lancaster and in Chester. So we provide the inpatient counseling for the patients that come into the hospital. And also we offer outpatient for patients that are not in the hospital who may be referred by their doctor or specialist that require or need that additional assistance.
When you talk about the inpatient counseling, are y'all screening them? Are they asking for it? How are they getting connected to y'all?
So we have a system, a computer system where it's called TelAsk, where they are imported to us when they get admitted into the hospital. So if I'm not mistaken, I think when they are admitted there, the nurses ask them some screening questions in regards to their nicotine intake. Once that is compiled, then we have a system called TelAsk that it will gather those smokers and send out to our list daily.
So I'm just personally curious, what do y'all find about inpatients in terms of their interest in quitting? I mean, I know it's probably across the spectrum, but just
it's wild. I'm gonna be honest. You have the good and you have the bad. You have the ones that, I mean, our job is difficult because their medical issues are not in regards to smoking. So let's just be frank. If you are a smoker and you're in the hospital, but you're here for pneumonia or COVID or whatever, and you're trying to get well, smoking is kind of not what you want to talk about. So you kind of have to be very creative in our approach to them and asking them those proning questions in regards to their nicotine intake, and just kind of letting them take the lead in that situation, because again, their main issue why they're admitted has nothing to do, maybe does not have anything to do with smoking. So, but I mean, we get the job done. It's just, I mean, and then we get surprised a lot that some people want to stop and they're in the hospital because they can't breathe. So now they know that my lungs is messed up and I have all these other issues. So yes, I do want to quit smoking, but this, that, and the third did not work. So yes, I won't help. Then you have those long-term smokers who've been smoking for 50, 60 years. They love it, they enjoy it, and they don't want to quit. But we still educate them and give them those tools. And the good thing about us that we offer is they can still reach out to us after they're discharged. So we don't pressure anybody. It's not, a big thing. We just let them know this is what we would request of you to do if you would like to do it. And we're here for you here after you're discharged. And, we can still make this work if it's an interest for you. And then we also partner with our lung cancer screenings. We have nurse practitioners that's on board that we connect with them if they want to do the lung cancer screening as well.
Thanks so much. Amy Levine, can I put you on the spot also, because you're doing the same type of work at Roper St. Francis, and I've noticed that you've been joining into, some of our functions, and I'd love to hear from you about your experience also. Let's see, is she still there? Maybe she had to hop out early. Oops, she might have hopped out early. Sorry about that. Okay, well, so I took a little bit of direction there. Beth, were you wanting to say something? You look like, no?
Well, I was just wondering, do we have anyone on the call from the Myrtle Beach area? I was getting ready to look in the chat box, but I don't know.
Raise your hand.
Yeah. No, okay. Just curious, I had a question this week from Representative Heather Amons Crawford, who's from Myrtle Beach, and would love for someone local in that area to address her as a constituent, maybe.
I have another question, but I'm going to pause a minute and see if anybody else wants to hop in. Raise your hand, throw something in the chat box.
Beth, this is Dave Keeley. I can give you the name of Deborah Dunbar. She's currently on the Smoke Free SC board, and she has been a local, she's done different things in terms of, health at the community level, but she has a lot of knowledge from experience in the Florence and Horry County area on tobacco. So I would suggest you talk to Deborah.
Gabe Glissmeyer, it's funny you raised your hand. You were the person I was actually going to ask a question of. So why don't you unmute and pose your question, and then I'll pose mine back to you.
Okay, thanks, Rebecca. Yeah, so I don't live in South Carolina. I live in Utah, but I've been tasked working with South Carolina on a bunch of tobacco policies. And so something that we're trying to do is partner with a lot of the LGBT organizations that are there, that are local, and try to host some, we're calling them LGBT tobacco town halls, where people can kind of learn about, why preemption and like why, flavors and why, why tobacco taxes are important and whatnot. Because I think there's a pretty good understanding in the community about targeted marketing, because people, will go to clubs, bars, whatever, and get coupons or whatnot. So people understand that aspect. People tend to not understand the, why would banning menthol impact the community in any positive way, or why would, preemption be an issue? And so we're trying to kind of get ahead of the curve and just get this education out to these community organizations, and then hopefully have those community organizations want to partner on doing a town hall meeting that would then be open to anyone in the state who kind of just wants to learn more about these policies. So next week I have a bunch of meetings, I think like multiple meetings every day with different local LGBT organizations, which is fantastic. Because obviously we know that there's a lot of other, sometimes more life and death policies happening in every state, usually during legislative sessions about LGBTQ issues. So that's something we're very, very excited about. And also just trying to get, parents from PFLAG involved and whatnot. So if you have LGBTQ colleagues or friends who are, interested in learning more about tobacco, we also are starting an online portal that's specifically for LGBTQ folks who want to get more involved in advocacy work. So I can put my email in the chat and you can reach out to me and I can try to help you out.
Dave, you answered exactly what I was going to ask you, because I've noticed you also have been on several of our functions lately, and I was curious what your interest was. So thank you for sharing that.
Yeah, of course.
Got a few more minutes, folks. What do you want to know? What are you working on that you need some help or support? Where are you working on something that you're stuck and you need to get some more resources and you want to ask this group? Where might you find such and such type person, just similar to how Gabe just did in the others? What do you want to know? What do you need to know? Do you have anything you want to share about what you're working on, a program coming up that you're excited that you think people should know about? Okay. Sharon, there's another question for you. Beth, go ahead while Sharon's reading Dave's question.
Well, I was just going to ask, maybe if Phil from Just Say Something wanted to say a little bit about the project that he's working on. I'm sorry, Phil.
No worries, Beth. And I was just sitting here. I said, well, maybe I need to talk about what we're doing in Greer. Dr. Keeley, I keep hearing you talk about all the great things that you're doing up in the Rock Hill area. And I hope your ears don't burn too often. But the last time I was talking to Beth, I said, I want to go to one of his meetings. I want to go spend some time with him. So next time y'all have a Zoom meeting, let me know because I want to participate. But we're very fortunate here in the upstate in Greenville to, it's all about relationships. And we're fortunate to have a wonderful relationship with some leaders over in the Greer community. And whether it's former board members or just people that we know or current board members. So we've reached out and have been very fortunate to get some of these people to the table. And so as we're meeting with bank leaders, business leaders over in Greer to talk about them moving forward with a smoke-free ordinance for the city of Greer, we've been very happy to the reception that we've gotten so far. We were going to have a meeting in January, but unfortunately, COVID is, raised its ugly head once again, and we had to cancel that meeting. We do have a meeting rescheduled for February, but one of the exciting pieces of this is preliminary conversations with the chamber is that the chamber wants to be the lead in this particular movement. And so we even have elected officials are like, why don't we have this? Greenville has it, Spartanburg has it. Why we need to have this. And so I'm very excited about this opportunity to be able to start in the Travelers Rest area or Greer area, and then eventually branch out to Travelers Rest and some of the other municipalities here in Greenville County. So that's just the tip of the iceberg for it.
Well, now I'm jealous, Phil, because to get the chamber engaged, that's something I really want to be able to do in York County, and so we can share strategies. Okay.
Wonderful, wonderful. And you know, it really helps to have a former board member who is immediate past chair of the chamber, but also sees the importance of what it is for the community, and who also is one of 6 children whose dad smoked cigarette after cigarette after cigarette after cigarette as a child, and has done everything that he and his wife can to keep their 5 beautiful daughters smoke free. So he's a great champion for this, and so I'm really looking forward to working with him.
Philip, just to let you know, Dave does have regular meetings, and they're great. And I encourage you to get on his distribution list.
Absolutely.
So you can shoot him your email address, or he can pop his in the chat box, you know, something like that.
I'll send it to him.
Okay, so there you go. Yes, he's definitely a champion to spend time with and learn from. What else does anybody? What else? Questions, thoughts, comments? Does anybody want to share anything about your tobacco work?
Rebecca?
I was going to say, I was just going to add one more thing that Beth has been helping me with too. This year marks the 15th year or 15th anniversary of Greenville City passing their smoke-free ordinance. So I've reached out to one of our major restaurateurs in the community, and he's willing to provide a statement to go into an op-ed that we hope to get into the paper PDQ about the benefits that he's seen across his restaurants since Greenville did pass the smoke-free ordinance.
Okay. Somebody started to say something a minute ago to me.
Rebecca, it was me. It was Sharon. I was going to answer Dr. Keeley's question about the pharmacy involvement in cessation, and are we doing anything related to that? So I'll just tell you really quickly. Through our tobacco control network, we've been introduced to the Community Pharmacy Enhanced Services Network, which is actually out of North Carolina, but it's an integrative network of community pharmacies that coordinate patient care with broader care teams and address a number of different things. They do medication optimization and some other activities for high-risk patients. And one of the things that they do work on is tobacco cessation. So we have started some initial reach out conversations with that organization to see what they've done across North Carolina and the successes that they've had there, and to see what we might be able to build for the future for South Carolina.
Okay, that's great. I did hear a presentation from some folks in Vermont and Indiana, and they have a kind of a step-by-step explanation of what they did, and I can, share that link. It was a webcast from the Smoking Cessation Leadership Center in San Francisco.
All right, for next couple of minutes, I'm going to ask Barbara Derrick to give a brief overview on what's going on in terms of point of sale efforts. We work with, well, they're all represented here, at least 2 of the 3, specifically on point of sale work, because I think it's really important for you guys to get a little update on that. So Barbara, just sort of like the 2-minute version.
Okay. Hi, I'm Barbara Derrick, and I work with point of sale impact grantees, as Rebecca said. They are involving Charleston, York, and Greenville County. So Philip, Dave Keeley, and Cindy. We've done some great work so far, as you've heard from them. We're getting ready to do reassessments because the assessments that we did are about 5 years old. So we're getting ready to reassess retailers in York, Charleston, Greenville, and Chesterfield counties. We'll start that in March. And we have a really good group together with Sharon's help, and Riata will start working with us soon, which we're looking forward to that. So we're moving right along. You've heard a lot about what they've done already, so I don't want to repeat that.
All right, and then Beth just threw something in the chat. You want to say something about that, Beth?
Sure, just that we are very fortunate right now, ACS Can, that we have a media advocacy staff partner who's working with Phil and a few other folks to do letters to the editor or op-eds around smoke-free preemption, tobacco cessation prevention efforts. So if anyone just needs help with that, if you need someone to review it, if you need to know what's the best process or some of even the language that we should use, we just finished a really good focus group, so we have some good language to use, then please reach out to me and we would be happy to help you with that so we can get some media and some movement.
Okay, before we lose everyone, I did want to put a couple links in the chat box. Does anybody have anything else? We have a really short, like really 3-question survey. Hold on. Should we each prepare our counterparts across the state? Austin, do you want to say something about that?
Yeah, one of the exciting things about this is to see faces and names and hear all the exciting things. And so as a physician, I'm thinking of a Venn diagram. Where is the overlap and where are the resources like Philip in his great presentation? He's right here in my back door and I didn't, ashamed I don't know him. And to ask, the Charleston Low Country people, who are your counterparts here in Greenville? And so how do we network? Because as a physician, I'm in my niche and you're in your niches. And then, how do we start to build regional and city awareness of who our counterparts are and strengthen our connectivity? So I'm just wondering if our homework could be for next month, each person, as best we know for right now, who are your contacts in your niche of this issue and what are their areas of expertise? And if, ask for permission and share emails and contact numbers as a way of enhancing the speed at which we can reach out to each other as a resource.
Brilliant question. Very good question. We will, I'll give that some thought and see how we can help that, how we can use the email group to do that, how Smoke-Free SC could facilitate sharing that information. It's a great question. Dr. Ronica is actually working with us on our Vape Talk program. He's representative of South Carolina chapter of American Academy of Pediatrics, and we've been working closely with him for quite a while. So thanks for making time today, Austin. Okay, so Megan is going to throw a couple links in the chat box. There's like a 3-question survey about today, just really quick to give us a little feedback, to figure out how to tweak this, how to improve it. And then we've got the registration link for February. Anjul Smith from American for Non-Smokers' Rights Foundation is going to host. And her focus generally, we haven't fine-tuned it yet, but is to educate us on what language really works at local level advocacy now, to get interest at a local level in policy. What they're finding with their work with American for Non-Smokers' Rights is that they're making a shift in what the language is about and how to talk to people at the local level. Anjul, I know you're not prepared, so I'm not going to ask you to make any comments about that right now, but she's going to be, unless you want to unmute and say something, but otherwise Anjul will be our host next month. Again, please mark your calendars for 4th Fridays. Just go ahead and block us off. One of the questions in that survey that Megan just put the link to was, do you have some suggestions for, other hosts for, and topics for future months? So we can book it out. Again, you'll be getting email from us from the new email group / listserv discussion group. I'm not exactly sure what we're calling it yet, technology wise. And I really appreciate everybody attending. Thank you, Beth, for doing the legislative update again. We'll hear more hopefully next month. Maybe there won't be any bad news to share. And Sharon, thank you so much for that just really thorough update on what you guys are up to at DHEC. I think that's been a really big help. We will also look at sharing the slides. You know, several people were interested in some of Sharon's slides because they were really useful data slides. Anything else, just you email me, Rebecca@smokefreesc.org. And, you know, thanks for being here and thanks for all your work, everybody. Really, really appreciate it. Hopefully this is one of many. Fourth Fridays, 10 a.m. Put it on your calendar.